A very good afternoon to all, and thank you for being here. I'm Dr. Astha Saxena, and I'll be moderating this panel today. So the topic is patient safety and the role of young healthcare professionals. When it comes to patient safety, I think we consider mental health, physical health, and emotional well-being of the patients. I'll be asking some questions from the panelists. And ma'am, for you, the question is, how can the medical institution instill the idea of creating awareness about patient safety at an early stage in medical education?
I think what we have today is a curriculum which is devoid of bringing in the kind of empathy that we have towards patients. Because in the olden days, a time when I did medicine, and this is almost 2 generations ago, we looked at it as a patient-centric approach. And today it has become more technology-centric and an organ-specific approach. And we looked at a patient either as a gallbladder, or as a uterus, or as an eye. And when we even refer to the patient, we look at bed number something, or that polycystic patient, or we look at that patient who has had a hemorrhage. So we've even forgotten that the person has a name to such an extent that they become almost inanimate objects and they are commodified. And in come corporates, and we find that they almost have a band, like how I have been put a band as I walked in. And when I looked at the band, there was no name on it other than business world. So if such is the situation, then we now want to know as how do we give an identity to the patient. So this person-centric approach that we need to inculcate in our young students who actually come out right from the day they enter the portals of a medical institution is to tell them that you're treating a person and not a commodity or not an illness. So once you take mind and matter, or you take mind and body, I think all the things will get into order. So you have to go systematically. History taking has to be very clear. It cannot be replaced by machines. If that can be understood right in the beginning, calling the person by name, standing up to welcome the patient inside, and making her comfortable or him comfortable, and then listening to the person, putting your cell phones off, having an eye-to-eye contact, keeping an atmosphere which is conducive for the person to talk about their personal issues, and not having too much of noise around, and not too much of the phones ringing up, the intercoms. I think that would be the respect you would give, particularly when you charge the patient.
Ma'am, I'm a psychologist, and the points that you have mentioned, I totally agree with it. Because when we meet patient, the patient want our attention. They want themselves to be called by their name. ना कि ऐसे कि वो patient is called by patient, as you mentioned. Bed number patient कौन सा है, 9 bed का patient कौन सा है, no. They want, like, if the patient's name is Aman, let it be Aman. So they will like, yeah, patient Aman, hi Aman, how are you doing? So they feel connected to the doctors as well. Ma'am, the next question for you, ma'am, Swati ma'am. As a veteran in this field, how do you think has the concept of patient safety evolved over the years?
Thank you, Astha. That's a good question. Thanks for having me around in the first place. I think over the years, we have evolved a lot in terms of patient safety. So over the years, I think at the era right now that we are into has moved from a goal to a concept. And the concept is that it is not a goal which has to be achieved today, tomorrow. We are not setting guidelines for us or some numbers for us that we have to touch. It's a whole process. We all need to understand that it is not something which is gauged or monitored by just hitting down the numbers. What you have as discharge criteria is met or not met, just coming to those numbers per se. It's all about a continuum, right? And in that continuum, a common example which we can understand is that the entire machinery of this patient safety and the health system is just like a cycle, wherein the young individuals, the young healthcare professionals, the doctors are those two wheels which will most often take the ride forward. But we most often don't realize that it's the other things like the steering, which is your nursing, there is the chain, which is your paramedic staff, and so many people like the ambulance driver. Everybody in this system is a part of this system. So it's a process. That's why I said it's a process. So every individual here needs to understand that they have a role, which is, so it's not like, patient safety is only my issue, or it's only a nurse's issue, or it's only a doctor's issue. No, the entire thing needs to be looked into a one full picture as such. So I think we've evolved a lot, and what is most important over here is to recognize that we have to create a system wherein we make it so friendly for the staff. Only if I admit that there is a mistake, there is a chance that I can improve. But most often what happens is a nurse creates some mistake. She will not bring it up on the table. She will not own it up. Because of the fear that everybody is going to criticize her, she might lose the job. So from a punishment, if we move to a reward concept, and if we all look at the patient safety as a goal for everybody to be achieved, I think that is what is, dynamic, and that is something that we should be working towards. So I think emotional comfort of everybody in the system needs to be very, very strong, that the nurse has to be emotionally respected, her work has to be respected as much as the individuals like the doctors the younger doctors who spend most of the time on the floors with the patients, the other paramedics, everybody. So everybody needs to understand and be recognized for the work that the great work that they are doing, versus the people who are at the top level. They of course have to see so many patients, they might not get so much of time, but it is the younger generation doctors who will be spending most of the time with these patients. And I think that is the entire concept that we have to work upon, and I think we have come down to that as well.
Yes, ma'am. So, I have seen junior residents in my hospital as well. So, as you mentioned, they spend more time with the patients than the senior doctors. So, yeah, we need some initiatives that we can train them more, I guess, in the field that they can provide health safety for the patient. Not in the concept of only health, mental stability, emotional support also. Ma'am, this will be an open question for all. How is tech helping safety? Are surgeries safe today? Do people recover faster?
I think this is a very open-ended question, and I think first and foremost, I would like to take it in two parts. Is surgery really required? Sometimes I find surgery is overemphasized and is done even if it's not indicated. So let me put it across, when what it really requires is a little bit more time and more counseling. Given the choices we have, counseling plays a very important role in trying to, explain to the patient what is required for her to actually manage the problem. And I find that in my specialty, for example, I find women who are in the age groups of even 28, 29, even though they've had 2 children, and just because they come with one episode of heavy bleeding, they are suggested to have a hysterectomy. And I think this is something which is horrendous when you have a lot of other treatments available, and to go ahead and just castrate this person and just get the uterus out, I think is absolutely wrong. And therefore, the first question would be, is it really required? So if we can answer that ethical question, if it was your own mother your sister or your daughter, would you have done that? And if that answer was yes, then okay, I would buy that thing. The second thing is, are surgeries safe? The answer is yes. With technology, I think a lot of things have improved. The monitoring systems that are there, the pre-anesthetic evaluations, and also the kind of blood gases, as well as how under anesthesia the patient is monitored, is certainly far better than what was being done earlier. But the core question I want to put across is, are we not doing unnecessary surgeries? And I think if we can work around that problem and also have the corporate teams not breathe down on the doctor's neck and say, how much have we brought this particular month, and have the clock ticking and say that your next increment will depend on how much moolah comes into the kitty on your name. So I think it's a kind of a vicious cycle. Now, they have to answer their investors who have invested in the company, and the doctors have to answer to the corporate honchos that if they don't bring in that kind of money, then they don't get an increment. And then on the top, everyone is quite nice and say we have to actually give the right things to the patient. So there's a sense of a bonhomie which is very superficial. Thankfully, I was not in a corporate sector for a long time, but I had the best of both worlds, being in the corporate sector and being by myself. But I can tell you very clearly, there's a very stark difference. When you're in a corporate sector, you always have to look at that taximeter running on your head. At the end of the month, they'll be looking at it and saying that we've not done this, we've not done EBITDA is not there. I had never heard about EBITDA when I was running the clinic myself, and I really did extremely well, and I still didn't know, because the pluses and minuses and numbers was not my forte. But only when I got into the corporate sector, I realized that I was being monitored. And I found it extremely difficult to say that the number of tests that came in was far less, the number of drugs that were being prescribed was far less, because I think the doctors have now been pushed into a corner that they cannot function properly, and if they have to function properly, they have to do this. So they are in a kind of a Christian pool at this point of time. So if I want to tell them, look, you have to practice ethically, you have to have the Hippocrates oath, they have a Damocles sword on their head with the corporates on that side. So please tell me, how do I advise my young students who come through my centers, because tens of thousands I have trained, and when they're training with me, there's absolutely no bullet on their head to practice unethically. And they all come and tell me, this is what we have. They get very fat salaries, they get poached from every clinic, and the moment they are poached and they're put into their centers, they're promised big salaries, but then the taximeter starts. So, to all the corporate sectors, I understand your own problems as well, but we have to find a solution to that. Thank you.
Would you like to share your insight?
Would you repeat the question for me?
Yes, ma'am. How is tech helping safety? Are surgeries safe for today? Like, are they safe today?
I think I have a very clear-cut thought on that. We have moved in technology. We have done leaps and bounds. I think after the last session that we had on AI, I don't need to verbalize it more. We have definitely, technology has added to, of course, a lot of astounding benefits over the open-end surgeries that we used to do. So definitely, I would say yes, recovery. What was the last part of the question? Definitely, it's very, very fast when you are doing a laparoscopic or a robotic surgery as compared to an open surgery, which would require a patient at least 4 to 8 weeks to recuperate from that. In that way, definitely we have made a lot of advancement, and it's quite safe in very well skilled and experienced hands. One. The second, technology having helped us in many ways, I think we don't require very hi-fi technology. But to make use of the technology adequately, I think sticking to the norms is the most important thing. Right? So if you have a system wherein you can track back your data, what tells you why a patient at all went to the ward after surgery and went to the ICU, you have to track the data every day. Right? It's the same way if you track the data from the emergency, the patient went to either the ward or went to the theatre, and then how much was the time? Did the patient get out of the ICU and come back to the ICU, which means why was there a need to go back to the ICU? So all these technology-driven data is what we have added a lot, have helped us a lot to bring down this incidence. Now the only idea is, or the only best practice is, you get these datas and stick to those datas and see them every day, read them every day. We don't need very hi-fi technology. You may not really require a retinal, whatever. You have all these technologies nowadays to predict. There are other predictors as well. But as long as we stick to those predictors every day in our day-to-day lives, I think we can do a miraculous job, and we are already doing. India is a country, you may not be able to afford very hi-fi technology, but do we need it actually? Whatever we have, if we make the best use of that, that would be step ahead.
Thank you so much, ma'am. Ma'am, so I'm a psycho-oncologist and I'm just 27 years old. So is there any advice that you want to give me? Like, this is the starting of my career. So is there any advice? Since we are talking on patient safety only. So
I think the very important thing is we need a psychologist in every consultation, and I think every patient needs the support of people like you, because many times they are very confused when a doctor talks to them in a lingo that they don't understand, and I think a friendly psychologist is an integral part of the OPD. Very, very important.
thank you so much, ma'am. Thank you so much. Thank you so much, audience.